So like I was saying, the albumin is gone. It's gone, right? You can't, because now the liver is not producing any more albumin. Now what happens is your bilirubin goes up because it can't go to the liver. And even if it does, right, if it eventually goes to the liver is dead. It's like going to a dead man's house. Like, dude, do you have lunch? No, I don't. I'm dead. Right? I know. But anyway, another thing, hyperestrogenism. I already talked about that, right? The estrogen is going to be elevated. And these people have, unfortunately, the progression of alcoholic cirrhosis or any kind of cirrhosis is cancer. I'm sorry. Hepatocellular carcinoma. Terrible disease. It's might kill. 20% chance going from cirrhosis into cancer. That's one of the risks. So, now that I talked about that, they probably won't die of cancer. You know that, right? I hope you're aware of that. Probably not. It's something else. Let me tell you. Now, I know I didn't really go on into details. Just for people who really want to know this, how do you know a patient actually has portal hypertension? And then it's just not like this guy's got obese belly. The belly is just big for nothing. Who cares? But what actually we do in the hospital, this is just a little more clinical. As a second-year medical student, I don't want to worry too much. But if you ever get tested, what we actually do is called paracentesis. And we actually you put a needle and you aspirate, aspirate the ascites fluid. You draw it out, and you measure something called the serum ascites to albumin ratio. So how do you do that? So you get your serum, right? I'm gonna erase this. Run out of space. So serum ascites. Right, over ascites. I kind of like to make it look like a formula. Albumin ratio. If this is greater than 1.1 gram per deciliter, it's definitely ascites. So how did they get this? I used to memorize this, and I'm like, wait a minute, let me think it through. I like to think and understand this. That's why I do these videos. Understanding how things work. That's what kills medical students. They memorize, and you ask them a couple weeks later, you're like, man, I forgot. So, in your serum, there should be an albumin level, right? In your ascites fluid, unfortunately, you shouldn't find albumin. So that's it. If the number is greater than 1.1, what they're trying to say is for this number to be greater than 1, right? Can you see? Greater than 1, you have to have a low number of albumin and a higher number of albumin in your serum, right? Because the only way you get, if you have a smaller number here, so you don't have enough albumin inside the acidic fluid, you wouldn't, right? Probably not. It's going to be low. But if you take your serum, it should be a little bit higher than what's in your acidic fluid. If you divide that number, the ratio together, let's say there's, 2.2 grams, inside your, and there's about 2. Believe it or not, 2 is less than 2.2, right? I know, right? It's kind of something. So 2 and 2.2 what? 1.1. Kind of made up that number. But it works out perfect. But I just want you to be able to see that the number of albumin inside your ascitic fluid, which is like you're stuck inside a peritoneal cavity, it's low. That means when you draw it out, it's mostly what? It's fluid. It's coming from the hepatic portal vein. Alright? Just kind of a little side note for you guys, I try to make things as comprehensive as possible. Now, while we kill this guy, at the beginning of this lecture I was saying, this guy's going to be coughing. And bam! You're like, what? Coffee ground emesis. Brown. Dark brown looking discharge. And what happens is the esophageal varices, they rupture. But you have to realize that can kill him, right? Because if you bleed, you can bleed to death, right? You can choke on your own blood. You can bleed so much, you can aspirate the blood into your lungs, causing some kind of pneumonitis. You can die of that. Or check this out. you have the portal vein, right, draining the fluid, and all of a sudden, this fluid is leaked out. It's leaked out in the peritoneal cavity. But remember, there's a lot of things in your belly. There's bowel, right, your small intestine. If bacteria gets in here, all of a sudden it infects this peritoneal fluid, you're done. You go into sepsis, baby. Now, we call that spontaneous bacterial peritonitis because it's very spontaneous. Bacterial peritonitis, SBP. This is what's going to kill the patients, guys. I know it's a sad ending. I should have made the story happily ever after, but I will try to. Right? Now the patient's telling you, I got some abdominal pain. Right? They're getting fever. They're vomiting. Right? It makes sense. If the bacteria is in there, you ever had a cut and it gets infected? Does it hurt? Yeah, it hurts. So the belly will hurt. You're going to get fever, then you start throwing up. Right? And how do you know? You take the belly, you push on it. It hurts when you push, but when you let go, they're like, oh my God, stop. That's called rebound tenderness. That's a surgical emergency. You rush them to the emergency room immediately because they're going to die of sepsis, right? So at that point in time, you want to treat them. You give them broad spectrum antibiotics. Give them ceftriaxone, Rocephin. You should take care of that at least pending the time because now their peritoneal fluid is infected. That's bad. You check them. You take your needle. You stick it in there. You pull it out. You go to the lab. You see gram stain. It comes back. Guess what organism is doing the damage? Let's start. E. coli. Man, this guy is a bad boy. You see that guy? He does a lot of damages. You probably heard about it. You're like, him again? Yeah. He has on his friend Klebsiella, Ella, right? And one of his other friends, strep pneumonia, right? Pneumonia. I think I spelled that wrong. Pneumonia, something like that. Oh, I got it right the first time. You get the message, right? These guys, you probably heard about them before. These nasty bugs, right? They cause UTIs, E. coli, cholangitis. E. coli is not. You know what? You know where E. coli is originally from? It comes from your poop, right? It comes from the butt, right? It stays in your gut. But unfortunately, it's the way it is. If you're able to like sneak out, bam, you got an infection. This is what the patient going to septic. They go to, all of a sudden they get systemic vasodilatation. You know why? Because now neutrophils are crawling like, come on, we gotta go get him. They get there. The neutrophils are in the process trying to kill this guy, phagocytose the bacteria. Bam, release the endotoxin. Endotoxin reaction. What's going to happen? It's a systemic inflammatory response. I'm not going to talk about sepsis right because that's a whole different story, and the patient turns warm and everything. They become hemodynamically unstable. It's not going to be happily ever after anyway. The patient is going to die. I know. So, that's the biggest complication. So you gotta work because you gotta get them. It's a lot of problems with this, guys. Now we've covered everything I think you need to know. One more thing, just for fun. You walk in the patient was talking to you. Their breath smells like a fresh corpse. I know nobody's probably ever seen that, but if you ever smell a fresh corpse, it's called fetor hepaticus. That's what your breath smells like. Just gonna put that here, fetor hepaticus. And it's basically because of the elevated ammonia levels in their body, and it's kind of, you start to smell it out of their mouth. Unfortunately, this is what eventually happens to people that drink excessively. Alcohol is an addiction. If you're struggling with alcohol withdrawal problems, I suggest you get help. There's a lot of support groups. There's Alcoholics Anonymous. This is a devastating disease, as you guys all can see right now with all the complications. These patients do not do well. So you want to catch them early. You want to save their life. And I implore you, if you drink and you have an alcohol addiction problem, get help. Get help. Because in the long run, when you show up in the hospital, There's only so much we can do for you. You know? Alright, students, I hope I'm able to break this down for you guys. I hope this is able to help. I explained to you guys the complications of liver cirrhosis, portal hypertension and its complications. That's kind of the summary. And if you guys have any questions, shoot me an email, okay? Make sure you subscribe to this video. I'm doing it for you guys, my fans, and I wish you guys all the best. Good luck. Take care. Like I always say, think positive, baby. Bye.
Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.